Hello everyone, we will learn today about the associated reactions in hemiplegics. In particular, hemiplegic patients, there will be combination of the movement, there will be no isolated movement. Okay, so first of all, in that associated reactions are abnormal reflex activities which occur in the absence of voluntary movements. In that patient, if we give any stimulus, there will be abnormal reflexes will occur because there will be no voluntary control on that particular muscles, particular movement. Okay, in the first is there are so many conditions. In that first is homolateral limb synkinesis. Okay, the first word is homolateral. It means same side. Homolateral, it means same side. Limb synkinesis. Synkinesis, it means together movement. मतलब सेम साइड की टूगेदर मूवमेंट होगी. मतलब इफ इन सेम in easy word, if I'm saying, if we do the if we ask the patient to do the this is for example, if we ask the patient to do the shoulder flexion, the patient will do uh, shoulder flexion along with hip flexion. This is not under the control of the patient. This is occur together. Okay, so this is called as homolateral limb synkinesis. The response of one extremity to stimulus will elicit the same response in its ipsilateral extremity. Okay, the next one is Ramist phenomenon. Okay, in that same if I ask in simple word, if I explain in simple word, is that if in that resisted abduction or adduction of the sound limb evokes a similar response in affected limb. In this, if I do the resisted abduction, if I give the resistance during abduction or adduction in sound limb, it means in normal limb. Okay, if I do the resisted abduction or adduction, there will be movement occur at the affected side. So it is called as Ramist phenomena. So first we see homolateral limb synkinesis, and the second one is Ramist phenomena. Okay, the third one is imitation synkinesis. Okay, so third one is imitation synkinesis. It means the kind of both are same, but there is a minor difference. Is that imitation it means नकल करना, right? सामने वो mirrors of movements occur in the affected side when movements are attempted on the unaffected sides. Okay, mirrors of movements occur in the affected side when movements are attempted on unaffected side. Example is flexion of the unaffected side will evoke फ्लेक्शन ऑफ द अफेक्टेड साइड. ओके, अगर हम अनअफेक्टेड साइड का फ्लेक्शन करवाएंगे तो विल फ्लेक्शन ऑफ द अफेक्टेड साइड. इसमें क्या है कि वी आर नॉट यूजिंग द रेजिस्टेंस. व्हाट इज दिस इमिटेशन synkinesis? In imitation synkinesis we are not using resistance and there will be movement, and this is not particular for the abduction or adduction, but the Raymer's जो we seen that कि in Ramist phenomena we are particularly for the abduction and adduction, and there will be must resistance. Okay, and in this we are not using any resistance. Okay, and instinctive grasp reaction. What we can understand from the name grasp, it means in there is any grasping movement will be occur. Closure of hand in response to contact of stationary object with palm of the hand. Okay, this is commonly seen in child. Yeah, okay, if we give a finger, the child will do the flexion of the palm. Okay, reflection of the fingers, sorry, reflection of the fingers will be occur. Okay, so in this, if we are putting any object, then there will be reflection of the hand, reflection of the hand. Okay, closure closure of the hand and reflection of the fingers. Okay, and this is particularly seen in the frontal lobe lesions. Okay, this is particularly seen in the frontal lobe lesions. What we have seen, we see uh, homo homolateral limb synkinesis, Raymer's phenomenon. The third one is mirror synkinesis, and the fourth one is instinctive grasp reaction. Instinctive grasp reaction, which is seen in frontal lobe lesion. We know about the brain part: frontal lobe, parietal lobe, occipital, and temporal. Okay, we know about the functions. If you don't know, revise it. Okay, from the book. Other one is instincting avoiding reaction. What we can understand from the name only, instincting avoiding reaction. Instincting avoiding reaction, it means there will be avoidance. Okay, stroking over the palmar surface of the hand. If we are stroking over the palmar surface of the hand from proximal to distal, in distal direction causes hyperextension of the fingers in the characteristic fashion. Okay, there will be extension of the fingers, in which instincting avoiding reactions. If we are giving any stimulus to the palmar aspect, there will be extension of the fingers. Okay, this is seen it is seen in the parietal lobe lesions. ये पर्टिकुलरली किस में देखने को मिलता है? इन parietal lobe lesions. क्या होता है? There will be extension of the fingers. What is the name of this? Instinctive avoiding response. Reactions. Instinctive avoiding reaction. You have to remember the name. Okay, this is seen in the parietal lobe lesion. The आगे क्या था अपना? It was a frontal lobe lesion. What is the name of that? Is instinctive grasp reaction. Okay, and the another one is Saussure phenomenon. Saussure phenomena. The name is quite different. Saussure phenomena. Okay. Elevation of the affected arm causes paralyzed finger to extend automatically. If we ask the patient to do the elevation of the shoulder, okay, to do the elevation of the shoulder, or in that there will be extension of the fingers. This is automatically occur in the patient. In some patient, this is not. This is the theory. Okay, you might see any difference in practically, but this is a theory. So in this, if there will be elevation of the shoulder, there will be automatically extension of the fingers. What is the name of this? Saussure phenomenon. ओके, सॉक्यूज फिनोमेना. आगे कौन सा वाला था फिनोमेना? Raymer's phenomena. Okay, there is a two phenomena: Raymer's phenomena and Saussure phenomena. Okay, and there is kinesis. कौन सा है? Kinesis, synkinesis, homolateral limb synkinesis, then mirror synkinesis. Okay, the last one is for today. Last one is a proprioceptive traction response. Okay, and this line